breast cyst. So let's go to the next condition, that is a breast cyst. Breast cyst is again a disorder which is occurring because of aberration during the involutory phase. So when there is an aberration during involution, that can result in breast cyst. Now there are several pathological mechanisms which have been postulated for a breast cyst. One of the pathological mechanisms says that breast cyst occurs because of an aberration during lobular involution. So when there is a slow lobular involution, that can result in a breast cyst. Another pathological mechanism says that then there is loss of stroma that leads to kinking of the ductules. Because of kinking of the ductules, there is obstruction of the ductules. There is ductular obstruction or obstruction of ductules. That leads to accumulation of secretions. And because of accumulation of secretions, there is formation of microcyst. Different microcysts, they are going to conglomerate together to ultimately lead to a macrocyst in the breast. So that's another pathological mechanism. Loss of stroma leads to kinking of ductules, ductular obstruction, that leads to accumulation of secretions, and that leads to formation of microcyst. Different microcysts can conglomerate together to form a macrocyst in the breast. Apart from this, two more factors which have been associated with breast cyst are hyperestrogenemia and hormone replacement therapy. They have also been, associated with breast cyst. In fact, hormone replacement therapy is so important that, breast cysts are mainly seen in females in an age group of 35 to 50 years. So they are mainly seen in females in an age group of 35 to 50 years. And if a female after 50 years of age has a breast cyst, then we should assume that she is on hormonal replacement therapy. Breast cysts present as a painless mass in the breast. They present a painless lump in the breast, and they usually multiple and bilateral. How do you investigate a patient of breast cyst? The investigation of choice for a breast cyst is a simple ultrasound of the breast. Investigation of choice is ultrasound. Now, when we do an ultrasound, a simple breast cyst, that means a breast cyst which is absolutely pure breast cyst, it is seen as a well circumscribed with smooth margins and echo-free center. But apart from this, at times breast cysts can be complex as well. They can be complex cysts as well when they contain a solid component. So when the breast cyst contains a solid component, that is a complex cyst. And when there is a complex cyst, a biopsy should always be undergone. An ultrasound guided biopsy should always be taken from this complex cyst to rule out a cyst adenocarcinoma. To rule out cyst adenocarcinoma, a biopsy is always mandatory from a complex cyst. Now, how do we manage a patient of breast cyst? For a breast cyst which is symptomatic or is a complex cyst, we should always go for a ultrasound guided aspiration. So, we should always go for ultrasound guided aspiration in breast cysts which are symptomatic or they are complex in nature. On ultrasound guided aspiration, the fluid which we aspirate, if it is non-hemorrhagic, that is serous, it is non-hemorrhagic, and after aspiration, if the cyst or the lump completely subsides, so after aspiration the lump completely subsides, then in that case we don't need to do anything further. Patient can be just kept in a follow-up. So after aspiration, if the fluid which is aspirated is non-hemorrhagic and the cyst or the lump completely subsides after aspiration, then nothing further to be done. Patient can be kept in follow-up. In case after aspiration the fluid is hemorrhagic, in case after aspiration the fluid is hemorrhagic, then it should always be sent for a cytology. Then the fluid should always be sent for a cytological examination. And in case after aspiration the lump does not completely subside, there is a residual lump left behind, the cyst or the lump does not completely subside, there is a residual lump or residual cyst left behind, in that case we have to do a biopsy from the lump. So that is the protocol of managing a patient of a breast cyst.